You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space. Ivan, please kick us off.
Hi, I'm Ivan Zach. I'm very excited to have a repeat offender. So we have the guest that is coming back. This is our friend, Dr. Kemba Marshall. Dr. Kemba Marshall is a practicing veterinarian, lecturer, and thought leader within the veterinary medicine. She approaches her work through the lens of One Health with a focus on human, animal, and environmental health. Dr. Marshall sees DEI as both a prerequisite for the sustainability of the veterinary medicine and fulfillment of the veterinary oath. Dr. Kemba, welcome to the show.
Thank you both for having me again. It is always a pleasure to be with you.
Excellent. Well, we heard there's a book out there that you wrote, which is exciting. Tell us more about it, please.
Yeah. So a few years ago, I was working with Wiley Publishing, and they mentioned that there was the appetite or the need for a book that would discuss diversity, equity, and inclusion, specifically within veterinary medicine. And when they talked to me about writing the book, so many times I think in our profession, we want to do the right thing. We want to approach the surgery. We want to approach the new technology in a way that's very thoughtful and very intentional. And I think sometimes if we don't know what to do, we're like, I'm not going to touch it. Like, I'm going to refer that. Someone else is going to do that. That's not what I do. In my opinion, diversity, equity, inclusion isn't something that we can opt out of. So the book is an A to Z guide. Every chapter is for one letter of the alphabet. And we take the approach that we define the term, that's the what. Then we do the so what. Why is this important in veterinary medicine? And then we do the now what. What is one thing that you can do tomorrow, no matter where you are? Shoot side, in a break room, talking to clients, talking to your team. What is one thing that you can do to advance this knowledge?
Yeah, Dr. Kemba, it's great to have you back, and thanks for being here. Why does this matter so much to you?
Great question. It matters to me because the problems that we have to innovate in veterinary medicine require the diversity. Someone has to say, I have a different thought. I see that problem differently. I see that solution differently. And they have to have that diverse thought, that diverse approach in a safe space so that they are included in the conversation. How many times have we heard the boss doesn't like to be wrong? You can't challenge in this meeting. And so many times people are sitting on their hands, sitting on their ideas. And then if that innovation is really going to be brought forward, it has to be equitable. My opinions, my thoughts have to matter as much as your opinions and as much as your thoughts, because gone are the days that we can say only a select group can innovate. Only a select group can problem solve. Only a select group can understand this. Where we are now, we have animals to treat and we have clients to serve. And as long as you can contribute or help with either one of those, then you belong in this profession.
Yeah, it's so fascinating. One of the things that brings up for me, which I think is really closely connected, you guys, I don't know, either one of you have heard of Google's Project Aristotle. So they study top performing teams. And I'm curious to know if either one of you know what the number one component of a top performing team is after Google did this 2-year study on 180 teams.
I would say trust.
It's psychological safety, which is shocking. It's like, doesn't really make sense. But then when you think about it for a minute and you think about it in the context of what you said, it totally makes sense, right? If you've got a really smart contributor and they don't feel safe to be able to come to you with a different viewpoint, it's not going to happen, is it?
Right. And it doesn't just impact that top contributor, because let's say I've read a chapter or, I was walking and I had the aha, and I come in the next day and we're in our team meeting and I raise my hand and I'm like, I got something I want to share. And let's say our manager says, I'm not interested. That's not what we're here for today. You'll need to do that at another time. Everyone who's in that meeting with me is like, oh, don't do that, because you've seen me have a poor consequence. And then you say, note to self, never do that.
And our industry is so vulnerable. We are very agreeable people. We don't have boundaries. We're yes sayers. So therefore, I think that's a huge kind of part of the burnout in our industry because we can't really freely speak up. And a great example just yesterday. So we have this one technician that I work with, this hospital where I'm at right now in Fredericton, New Brunswick. It's I'm not all the time here. So last time I was here about a month ago, and one of the technicians who I worked with, she's very nervous person. She doesn't want to share, but she feels in our organization that she can, so she can approach me as a CEO and say, "Hey, I think about this way, this way." We had a really good conversation, exchanging opinions. A month later, I come here and she said, "Why do you hate working with me?" I was like, "What the hell is going on?" And she says, "Because you haven't been here for a month, I saw after our conversation last time, you asked everybody who's doing the schedule not to schedule you with me." And I'm like, Jesus, like, why would you even? And I said, I'm so grateful that you can bring it up to me in this way too, because this is so not true. But it's so hard to get out of people in our industry to share their ideas. And even after that, they doubt it and they think that just because by coincidence I wasn't scheduled with her, so now she's doubting it. So I really like that, that we can put emphasis on that in our organization and drive it. And this just this just speaks to our industry and what kind of people we are.
Absolutely.
And also worth complimenting you. Here you've got a really nervous person that comes up and asks you, why do you hate working with her? I mean, that she feels safe enough to do that, which is pretty cool.
Exactly.
So you're pretty cool, at least today.
Yeah, on a good day. Yeah.
Yeah. But I mean, just take that further. So, what if that individual said, "Are you sure you calculated that drug dose the right way? Did you do that in pounds or did you do that in kilograms? Is that catheter good? Did we flush?" Think about the millions of decisions that are made when someone says, I have a question. I'm not sure. I have an observation. And think about the number of times that those individuals don't say anything, right? So that person says, Mrs. Jones doesn't know how to pill a dog. Mrs. Jones actually can't hand walk her horse anymore. And if that person is afraid to say the one thing to you that says, "Why do you hate working with me?" Think about all the other patient impact things that they will not share because they're not psychologically safe.
Yeah, and it's not just that, because then diversity does play another role, because now you've got safety, but if you're all the same, you're not having these diverse viewpoints, which could be the magic to make the company more successful or to provide a better standard of care. So talk to us more. Let's get a little deeper.
Yeah, yeah. And that's a great one because I think so many times when people think about diversity, they're thinking about the things that we can see: race, ethnicity, gender. That is not even the tip of the iceberg. Let's stay with this same individual. Let's wonder, maybe this individual is neurodiverse, right? Maybe this individual thinks different ways. Maybe this individual organizes problems in different ways. What do we do when those individuals don't, quote unquote, fit in? Right. And so when we think about that diversity, someone has to say, "I am struggling with this, and I wonder if the owner is struggling with this." And so when you think about things like neurodiversity and you think, "That's not my team, that doesn't matter," think about more and more when you travel, when you're somewhere, that we have less and less verbal descriptions and more pictures. Why is that? Because when we think about diversity, we know that people learn and process language so differently. But if I can give you a picture, if I can give you an image, if I can show you, here's how we clean that ear, if I can show you, here's how we rewrap that tail, if I can show you that, then so many times one of the most common ways that we all learn in a similar fashion is by pictures. And I think that that is important because we walk away from things that we may not all understand commonly because we're aware of the number of diverse learning styles, learning approaches that there are today, and they've always been that way.
Yeah, it's so interesting because I took this course at Stanford, and one of the courses was on innovation, and they really opened my eyes to diversity because when you hear it in the media and how it's handled, I think that a lot of people understand the whole the whole diversity in innovation a little different, and it's been taken out of context and say, okay, in each company we have to have certain number of gender, ethnicity, religion, or I don't know what it is, and so we have this diversity, and it was kind of forced on people. What they explained to me, they said, look, if you're sitting here, three doctors solving the problem, how to do the job the technician is doing, you're going to be out of context. You don't do that job. You don't even participate in that. And then if you'll have technicians only deciding this and doctors, you're not going to have a receptionist who actually talks to clients, and this is how it reflects on them. And then they're not out of your field where you kind of box yourself with the education and the solutions that you're used to. So someone doesn't have to be higher degree of education. They just need to have a different opinion. And in many cases, it has actually nothing to do with the race, ethnicity, religion, your food preference, or music. It really is about having a person that is completely different from a different position from work, and just to contribute an opinion. So they kind of explained it to me. I said, okay, well, we really take it a lot out of context, and the innovation happens when you really have someone that says, hey, did you think about this? And it could be anybody. It doesn't have to be a certain degree of education. So that was very interesting to me. I'm going to throw a kind of a flaming question to you, though, right after this. With what's happening right now, do you think we're in danger of continuing this open conversation about it in terms of the political environment of what's happening and how the DEI is disregarded? I think, again, for not understanding the full value of it. And if it's too political going right now, we don't have to, but do we feel like this is going to be now a setback?
Are we throwing the baby out with the bathwater? You know?
Yeah, like, is
Yeah,
that what?
yeah, great question. We can't, right? Because it goes back to the reason I like to include that in my introduction. Let's go back to the veterinary oath. The veterinary oath, number one, is very similar to the veterinary technician oath. The veterinary oath or veterinary technician oath is taken the day you graduate. And it says what? I solemnly swear to use my knowledge and skills to benefit society. Society is the first benefactor of our knowledge and skills. And then we get to animals. So we can talk about who's in office, who's not in office, what's a law, what's not a law. The veterinary oath, the veterinary technician oath that we say, I solemnly swear, is what is our North Star. And so when we think about benefiting society, that is society writ large, every single person. Why is that? If as long as we are going to be in situations where we need people to come to us with their animals to administer care, or we need team members who can be trained to administer that care with us, our profession is bringing members from society to serve other members of society who happen to have animals. And so there is not a time that our profession can say, that's it, it's a hot potato. We can't talk about this, because our oath calls us to do more and to think more inclusively about society.
Yeah, I love that. And, I think Ivan has teased out a great point, which is like perception is not always reality, right? And it's a problem that we all have as humans. But I think, and the reason that we were so excited to talk to you again is because there's a hidden gem for every veterinary company in the world, which is innovation is bred from diversity. Different viewpoints, different points of view help solve problems in a different way. So, if you're out there and you're struggling with a problem and you're trying to do it with the same people over and over again, it's probably not the right way to do it. You might want to pull in some diversity to that conversation. And how do you help people understand the value through the book that you wrote?
Yeah, great question. So when I think about the practice of veterinary medicine, I remember in vet school, the amount of time that we spent understanding how to take a thorough history. And so when you take that history, we understand things like how to ask an open-ended question, but more importantly, how to ask the correct individual that question. So many times, one of the questions that a veterinarian will always ask you, what is this animal eating? Not what is this animal's diet, because people know the right question. Oh, balanced kibble with plenty of water. Like, they know the things that we want them to say. But when I ask, what is this animal eating? Then it's that open-ended question where I really am looking for this individual to contribute with me in figuring out what's going on with this animal. And if we're talking anytime that there are children involved, anytime that there's two people in the house that are giving treats or walking, anytime that there's a grandma or a grandpa in the house, or anytime there's been a large family gathering and food has hit the floor and multiple people are in the house, the more that we know about the people, the better we can understand problems that may be impacting these animals. And so, not only the book, but I think the very practice of veterinary medicine is better when we are more inclusive. I can think so many times I'm talking to a mom or a dad, and we're talking about a parakeet or a rabbit or a gerbil. And then, you know what? It's the little kid who's in the room and says, "This is what he really eats. This is what I do with him in my room." And I'm like, oh, now that I have that additional history, let's be more involved. So I think the whole book, the whole point is to say when we are individuals who are focused on delivering care to animals, the more inclusive we can be with diverse individuals who all in some way touch that animal, then the more that we can do to what? Fulfill our oath and now say that we're going to diagnose diseases, we're going to diagnose and treat diseases. And I think veterinary medicine in and of itself is very inclusive intentionally.
You're really reminding me when talking about the child who drops food on the floor, cases that we have with pot toxicity. When you're talking to the family and the dog is clearly altered and incontinent, and then the teenager is standing there with the family and not wanting to admit to what actually happened. But
Correct. But you have to be aware of everyone in the room, not just the person who's going to be paying, not just the person who, seems to be the person who's, the higher authority, if you will, in that family. You have to observe. And then what do you have to do? Include that teenager and say, "You're not going to be in trouble with me. I need you to tell me what's going on so we can help care for this animal," right? Because the more that we can include the animal owners in that diagnosis and treatment of disease, we know the better animal outcomes we have.
yeah, and it actually really helps to when you get on that plane of trust too, because people like in those situations, people are paranoid that you're gonna, especially like we have pot is legal, but I actually had last week a more profound toxicity. It was actually both pot and cocaine. And then we tested positive, and there was a child in the room. So it was very interesting how to navigate that conversation and then not to expose someone to information that they shouldn't know, but also say, hey, I really need to know because we need a right approach because we're dealing with serious stuff here. And anyway, those are always interesting conversation. How do you get to, trust level with the customer without them thinking that you're going to report them or anything like that? Dr. Campbell, what's the big dream? Who is this book for? Who do you want to have that book on their table in our industry as a day-to-day? Is it a good book for, reception area? Who should buy it? Who's your target customer, if you will? And where can we find it?
Yeah, so I tried to cast a wide net. So I say that this book is for anyone who works with or cares for animals. And the book is written so that if you're in a break room and you've got 10 minutes, or if you're in a team huddle and you've got 15 minutes, or if you're a young person who aspires to be a veterinary caregiver, if you're a person who's a little bit older and you're like, I want a new career, I want something that gives me purpose, that has passion, because veterinary medicine is all about passion. We don't do this job and say, I've removed 35 staplers from that 12 pack of papers today, so I'm going home. Veterinary medicine requires emotion, and we're pouring that emotion out all of the time. So anyone who works with or cares for animals should, and I hope will get a copy of this book. It is everywhere that books are sold. So Barnes and Noble, Wiley Publishing, Amazon, it's everywhere. And my big dream is that when I think about the individuals who are reading this book, I have more people who want to come into the profession of veterinary medicine. So years will pass and people will say, you know what? I read that book and I said, that's what I want to do too. And I found myself in the profession of veterinary care because this book sparked something in me, spoke to me, or I rediscovered my joy because this book made me say, yeah, this is what I said yes to when I was so young. This is diversity, equity, and inclusion in veterinary medicine.
Amazing. And a couple last questions. We're already out of time. Another innovator, somebody you think we should have on the show?
Yeah, so another innovator that I would highly recommend, Dr. Michael Blackwell, who's doing a lot of work with Align Care. And that is all about how do we think about access to care for individuals who may fall below a certain socioeconomic status and their pet bonded family members who need that care.
And I guess as the book recommendation that we always ask at the end, it is your book. So
Absolutely. It is Diversity, Equity, and Inclusion in Veterinary Medicine by Wiley Publishing, edited by yours truly, Dr. Kemba Marshall.
thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.